Hello and welcome back to Kariso. Today we're going to be talking about heart failure. First things first, what is heart failure? As the name implies, the heart can't pump blood as well as it should. There are two kinds of heart failure, systolic and diastolic heart failure. If you've been watching my videos before this, comment down below what do you understand by systolic and diastolic. I'm going to be explaining it in a while anyways. Systolic heart failure means the heart can't contract properly, and diastolic heart failure means the heart can't relax properly. Now, to explain this in a way that you could understand, imagine the heart as a water bottle. Alright, now I don't have a water bottle with me, but imagine there's a water bottle here and I filled it up with water. Now, a normal heart, when it contracts, you squeeze the bottle, water flies out, correct? Okay, when it comes to a systolic heart failure, it means that the heart isn't strong enough to pump all the blood. So imagine holding the same water bottle, but now only pinching it with two fingers. Not as much water is gonna go out. And for diastolic heart failure, it means the heart can't relax as well. Imagine the same water bottle, but now there's only half the water there. Even if you're squeezing with all your force, water is not going to come out because there's not enough volume of water inside to come out. That's basically what heart failure means. Your heart is the organ which is pumping blood throughout the body. So the pumping should be efficient enough so that the whole body gets enough blood, enough oxygen, enough nutrients. So what's so great about heart failure? What's wrong if someone has heart failure? The heart has 4 chambers. Let's just call it 4 rooms for now. The top rooms are called atriums and the bottom rooms are called ventricle. So we have the right ventricle and the left ventricle. The left ventricle receives blood from the lungs and pushes out to the body. And the right ventricle receives from the body and pushes out to the lungs. Now, imagine your heart to be a bus stop and the blood are the buses. So imagine a situation where a lot of buses are coming at the same time, but then the buses aren't moving beyond the bus stop. There's a roadblock or something, the buses aren't moving. What's going to happen? The buses are going to get backed up all the way, causing a traffic jam, correct? Same thing happens in the heart. When the left ventricle can't contract properly and push blood out to the body properly, the blood which stays there is going to get backed up and it backs up into the lungs. Same thing with the right ventricle. If the right ventricle can't pump properly and push the blood out to the lungs, everything is going to get backed up to the body. This is where all the symptoms come in. Now there's too much fluid in your body. So when the fluid accumulates in the lung, it stays in the lung. It's going to disturb the breathing process, the gas exchange process. So the symptoms are shortness of breath, as I explained, because there's too much fluid in the lungs. Cough, sometimes they'll produce frothy white or pink sputum. Orthopnea. Orthopnea means the person feels difficulty breathing when they are lying down, but then when they sit up, it's better. A good way to find out if they have this problem is to ask them how many pillows they use when they're sleeping. If they can lie flat with a single pillow and sleep, no problem. But if they require like 3 pillows just so they can sleep comfortably, or not, they can't sleep, they feel very breathless, then they have orthopnea. Next is paroxysmal nocturnal dyspnea. I'll explain this in more detail in a while. And peripheral edema. Peripheral edema is exactly what was written in the thumbnail of this video. Basically, because there's too much fluid in the body, the right ventricle can't pump properly, so all the fluid gets backed up into the body. This will cause swelling or edema in the body. So places like the feet, the ankle, the leg, the abdomen can be swollen, and this is called pitting edema. When you press down on your leg for a few minutes and you let go, it's not going to come back normally. It's going to have a dent there. So that's what edema means. That's what peripheral edema means. Now, paroxysmal nocturnal dyspnea. Word by word, paroxysmal means sudden, nocturnal means night, and dyspnea means cannot breathe. So that means people who are sleeping at night, all of a sudden they have this attack of breathlessness. Suddenly they'll wake up, they couldn't breathe, they have to sit on the edge of the bed, they have to open the window so more air comes in. Why this happens? Okay, imagine this to be your lungs. This is the side view of your lungs. So in the morning when you're standing up, when you're upright, even though there's excess fluid in your body, the fluid is all going to be down here. So there's a lot of space for gas exchange to occur. So your breathing doesn't really get interrupted as bad. But then when you're lying down, now all the fluid which was at the bottom is going to cover a wider surface area. Now this means more of the gas exchange is going to be interrupted, and this is one of the reasons why they feel a sudden attack of shortness of breath. Another reason is when we are sleeping, the respiratory center in our brain is less active, less responsive. So as the oxygen level in our body keeps going down, it's supposed to indicate to us when to breathe faster, when to breathe harder, when to hyperventilate. But since it's less responsive at night while we are sleeping, it doesn't detect or it doesn't respond as well to the drop in oxygen. That's why when it reaches critical level, all of a sudden they wake up feeling very breathless and very difficult to breathe. And the third reason is because at night while we are sleeping, the circulating adrenaline in our body is very low. When the circulating adrenaline is very low, the heart becomes more relaxed. And when the heart becomes more relaxed, it's going to pump even more slower, even more weaker. If a person already has heart failure and they're not pumping properly, when the heart becomes more relaxed, it's going to get even worse. So what causes heart failure? Heart failure is always a secondary disease. That means something has to happen first, and as a result of that, then heart failure happens. Heart failure doesn't come by itself. So what are the something which could lead to heart failure? These are things like hypertension, ischemic heart disease, valvular heart disease, arrhythmias, atrial fibrillation. What can you do if you have heart failure? Or if all of a sudden your leg is swollen up, your body is swollen up, and you have difficulty breathing, you can't sleep with one pillow, you need 2-3 pillows just to sleep comfortably. What can you do? Well, first and foremost, as I always say, visit the doctor, get your heart checked, get everything checked, follow their advice, take the medication, don't skip out on your follow-up. Next, the other things you can do besides that is, if you're a smoker, quit smoking because it's not getting you any healthier. Reduce alcohol intake, reduce salt intake. Comment down below why you think we should reduce salt intake. I've already explained it in the previous video. In the next video tomorrow, I'll re-explain this one particular concept. But if you remember, please do comment down. It will be really helpful for the others as well. And lastly, stay active. Exercise as much as your body can tolerate. You don't need to go to the extent of being so breathless after exercise. Just exercise as long as it feels comfortable to you. Staying active is very important because you need your heart to pump properly. You need the blood circulation to go everywhere. If you found this video to be valuable, if you learned anything at all, I only ask one thing: share the video with your friends or family members. Spread the knowledge. If you haven't subscribed to us yet, go ahead and smash the subscribe button and hit the bell icon. YouTube's algorithm is changing all the time, so I want to make sure our video reaches you. And if you want to discuss more in detail, you have questions to ask, you can always find us in Facebook in our group Curry Soup. And until the next video, in anything you do, do your best and be the best version of yourself. Bye-bye.